Today, we are going to discuss about the levels of prevention. We can give a small introduction to the levels of prevention. The goal of medical science is to promote health, protect health, preserve health, and minimize the suffering and distress. This can be achieved only through the prevention. Levels of prevention is used to improve the overall health. The concept of prevention has become broad based. There are four levels of prevention. The first one is primordial prevention, second one is primary prevention, third one is secondary prevention, and the fourth is tertiary prevention. The primordial prevention aims to reduce the number and impacts of complication. The primary prevention aims to reduce the prevalence of disease by shortening its duration. The secondary prevention reduces the incidence of the disease, and the tertiary prevention establish and maintain the condition that minimize the hazards to the health. The first one is primordial prevention. It is a new concept. Here we are giving a special attention for the prevention of the chronic disease. It is for the prevention of the development of risk factors. The main intervention of primordial prevention is through health education. The second one is primary prevention. It can be defined as the action which can be taken prior to the onset of disease, which removes the possibility that a disease will ever occur. It includes the concept of a positive health. The primary prevention aims to promote the general health and well-being by the quality of the life. It prevents the occurrence of disease and promote the prolonging life. The WHO has recommended two approaches. The first one is population strategy and the second one is high-risk strategy. The population strategy, this approach is directed at the whole population irrespective of the individual risk level. For example, the studies have shown that when a small reduction in the average blood pressure and the cholesterol of a population would produce a large reduction in the incidence of cardiovascular disease. The second one is high-risk strategy. It aims to bring the preventive care to the individual at special risk. This requires the detection of individuals who are at high risk by optimum use of the clinical methods. The primary prevention is a holistic approach. The fundamental public health measures and activities such as sanitation, the infection control, immunization, protection of food, milk, and water supplies, environmental protection, the protection against occupational hazards and accidents are all the basic to primary prevention. Next, we can discuss about the secondary prevention. It can be defined as the action which halts the progress of a disease at its incipient stage and prevent the complication. The secondary prevention attempt to arrest the disease process, restore the health by seeking out the unrecognized disease and treating it before irreversible pathological changes takes place and the reverse communicability of infectious disease. It may also protect others in the community by getting the infection and provide secondary infection for the infected person and primary prevention for the potential contacts. The secondary prevention is often more expensive and less effective than the primary prevention. The last one is tertiary prevention. The tertiary prevention signifies the intervention in the late pathogenous phase. It can be defined as all measures available to reduce the limit impairment and disabilities, minimize the suffering caused by existing departures from good health, to promote the patient's adjustment to irremediable conditions. The tertiary prevention extends the concept of prevention into the fields of rehabilitation. Hope you all understand the topic. Thank you.